This video is talking about general elbow pain. We've found that most elbow pain is pretty complex, but here's some little tidbits that might be able to help. So talking about radial head position is a pretty avoided or missed piece in a lot of clinics. So looking at radial head position and how far forward in the joint that radial head is sitting, and how is terminal elbow extension? Do they have any pain or catching, clicking, pressure with full elbow extension, especially if it's at the olecranon? So first, finding the radial head joint, I've marked it with a pen. You're going to take a foam roller or a lacrosse ball, put it in a doorway, and get right on that radial head. And you're actually going to pulse your body weight into that radius, kind of moving in and out of pronation, supination, trying to mobilize that joint. The second piece that you can try, using a foam roller or a towel roll. I use a towel roll in the clinic because that's a little bit more convenient for me. Actually gapping so that that olecranon is stepping off of this towel roll, and you're actually going to drive your forearm down past the edge of that towel roll, stretching that connection of the where the triceps gaps over onto the tip of your elbow or your olecranon. Foam rolling your tricep, especially getting up near the edge of that olecranon, kind of beating up that area, getting where your long head inserts onto your scapula. That can be a pretty good one too. Doing a general stretch of your tricep. You can add more elbow flexion and extension while you dip into shoulder extension. Beating up your own forearms with a foam roller or a lacrosse ball. Or lastly, doing your own elbow mobilization. Using the palm of your hand, grabbing onto your radius bone, which is your thumb side, and actually driving it posterior. And see if in the end that gives you more true elbow extension.